MALO Dr Ema Mo'unga mau fia AUPITO ke kama i po kalamo e poni. Ko taha ko e tau ngahi longai whanau ko mua o sia ai ako na mo si o whenga ki ai ke mo tokoni mai ki tau tolo e kakai tonga pe ko kakai Pacific Islander i he wafonua kon ko i ta. Ko tai nini te wata ki whenga mareka te koe ki hanga mua o ki whamatala i mai ai mea aku ke whakahoko i he tai nini pa mo ngaue ka ki mo aia o ku fima o ke hanga whamatala mai ka te kmautol aho o ngomatua ho kui o ke kamata anga ia ilo he kakaitonga a koe he ku ke keisi te nau ilo i koe i o ngomatua o a koe pia mo o matua mo matua ho mari o ku mari fokia a Dr Ema Mo'unga pia mo ai sea Mo'unga pa koe nang kita mai ki Tokoua pe aku ensure sa ia ema he travel around in maman kotoa pio eva mo ai ngahi me akai ki ko ia ema malo lava mai ko atu leva whenga mari ko ni ka te koe
Malo Ivoni and Meleto for having me on your show. Ko kuhingoa ko Ema Tali Mo'unga ko kuongo matua ko te Veitatali pe mo mohokoi alatini tali ko hongo matua ku tamai ko Viliami si ulua tali pe mo Alicia Vaka pe ko e hongo matua ku fae ko helu palatavake alatini pe mo Emanita Pauni kana maritu o ua ku io kuitangata so ko marifika ua ko moala makalo ko e ongo matua ku Hispaniti ko Hetweni Mo'unga pe mo Siale Halafihi o kuna nofo atu i Kearns, Utah.
Malo apito e malo apito ku ilo he kakai ho o mato mo o kui ko mo ko puna ni o kina tolo a Dr Ema Mo'unga te ta ho ko atu le whamatala e mai ange te ke hanga o whama ki he kakai e tau kau whanongo i he poni ho o ngaue o whai pia o mai mo o ngahi contact number ko hike nau lava o contact ka te koe
Iyo, so naku graduate he tau ko osi moku Toketā ko ngaue i Exodus Healthcare Network oku i West Valley i mui he Jordan Valley Hospital and naku uluaki ngaue as a nurse practitioner i Utah County for Itaweua doing urgent care. So taiminio ko ai family medicine. So ko umahaki ko ino hange ko suka ko toto maulunga mo hafua I'm currently working he taimini he office ko magna yai office fi kliniki ko ni one in Tooele and one in St. George. So I go to both the Magna Bamwe West Valley office and I have 1/4 of my patients kautonga. And I just want ke iloi I kautonga, you know, you have a voice in the medical field that understands a condition.
Malo apito ema o kuanga fe ai kapa koe ko fine eki ko fina o ke alat ke te koe ke hanga o take care o refer faka'eke'eke.
So most cases oku alupe I patient ki he na insiwa o sio pe oku I'm covered under Medicare. I see Medicare and Medicaid patients and most insurances. So o taipe beo ki ngoa Ema Mo'unga and kapau ku kavau under you, then you just tamai beki office go i West Valley. So again, it's Exodus Healthcare Network. Ko fika go ke office ko valu no TAHA uani manoa hiva ono tolu valu and just set up an appointment. I work 14-hour shifts 3 to 4 times a week, so most cases o te lava o sio boy.
Malo apito em
Koto MALO AUPITO Toketā Mo'unga si MAHU'INGA Maari pe mo Tala Koula i he fiafini pe ku ke ilo ko fu fakakolo ala hi ni ki tau kainga e taimi nau whanonga mai nau ilo i o whangakui e ngo mātua pe me iai pe o ku osi iai pe whahinga whalala pe mo ilo i he whaunga ngaue te ke lawa whai ko ngā ko ilo ai ni ihi ko ni si o whangakui o ku ke lawe i pe ema o ku lahi AUPITO ai kainga tau tolu he Pasifiki o tau kainga tonga ko wesia pe mao e he COVID taha hiwa. Pe koe whakoutua koe ni, koe whakoutua whakaririfu, he koe mahaki whakamamani lahi eni, pe ako si wesia i ho tau kainga tonga. Koe tuunga koe o ngaue o ku ke whakahoko. E koe pe ako tui o ku ke iloi pe ke lavei ai toko lahi e ni ihi mahalo ko nau alu atu mahalo pe ku nau mao e whahinga koe whehu i rewa o ke pehe o kuanga whehe ai hanga e he COVID taha hiwa o si ilave kovia a ho tau kainga Polynesia. Or how has COVID-19 affected the Polynesians here in Utah?
So the reason why I was like UHINGA disproportionately impact Polynesia, it's because we're frontline workers, we're essential workers. We work in the communities, healthcare, the falekais. I was like, so essential workers get affected a lot. I was like, so that's why the Polynesian communities are affected a lot. Another one, comorbidities. And based on the studies, diabetes is one of the higher reasons. If you have diabetes, if you have hypertension, it contributes to making you susceptible to getting vilasigwani. Another one is we live in multi-generational homes. And because of that, and then they come back and then infect the older generation. And another one is or we don't have insurance, so till it's you have to be or test. Another one, it's it's in our culture or mali. And so it's within our nature and our culture to fekau'aki because it's a sign of disrespect if we don't attend events in person instead of Zoom. So, a lot of contributing factors, which kind of plays against us. So that's why we're affected.
Oko lawe ema koe mea koe nine sai peni ihne whai mau tala noa ki e mua. Pe mahalo ku ngari mahalo e fo'i ai kāinga tonga, he whanongo mai ki hoku reo mo i voni, he tautou kore, ke nau toi tokanga nge. Pe koe ngai mea koe ni ki hono whengai ke whakaehi. Te koukore makore pe mo i voni ke te lawe mua lawe ki ai ema, vahe pe mo tau kāinga, how to prevent getting COVID. This is something that we keep saying over and over and over. And like I said, I think they're probably like tired of listening to Ivoni and myself saying this. But I think with our people, it needs to be reminded all the time,
Right. And I agree. I completely agree with you, Mele. It's, I know that there's COVID fatigue, that, we're tired of hearing I met that every time. but you'll be surprised how effective wearing a mask, doing a mask, washing your hands, and social distancing, those three things alone, decreases or mitigates the spread of this virus. We don't have an actual cure for COVID-19. Like, this is a disease that needs to be respected. So, and the best thing we can do, we can't put you on antibiotics. The only thing that we can put you on is steroids, and all it does is, kind of control your symptoms, but you're going to go through, most of the symptoms for up to 14 days. So this is not something you want to catch. And I need to tell my patients, and I remind them every time, just because you got COVID does not mean you're immunized. So yes, studies that are coming out, people can get COVID twice. So kind of like the influenza, that it stays in your system. The antibody stays in your system for about 9 to 12 months. And then it goes away, which is why you have to get it every year. And COVID, on the other hand, it's 1 to 3 months. We're already seeing a decrease in your antibodies. So that's why someone can get COVID 2 times. So just because you get COVID doesn't mean you mask. You don't practice social distancing. Be careful, because you can get it again.
Kawana I he foi poini MAHU'INGA AUPITO o koutu o totonu ke toi whakaongo ia. Whaamu kita nea te futalupite ke te hanga I fi ke whanongo kotoa pe ai utāniki ai. Ke mahino ki ni I koe na anau osi CV positivi, pe anau osi go through e toi lava pe o nau toi puke, o ka pau he kai ke nau tokanga. He koutu o kwai ni I nau whakakaukau nau tolu ku nau invisa polo nau tolu I o kai peke nau toi mahal tu nau smae nau tolu kai pete nau toi puke nau tolu ia. Mahal wa ui ke nau whakakaukau pe o nau osma o awia pe sai pe ke toi ma o awia e he COVID. Ka kona mahino mo whakamatala pe koutu o ku kauen I he poini MAHU'INGA. E manake lave ane nai ki hianga koeni o e tau feohi a ki tau tolu mo tau tupuanga he tau tala, tau ulnganga whakatonga. O mo oni foki. He kuhange foki hangari kai ke whakaapa ka pau te feiloaki a te uhau koeni gen ka suka aivoni kai ke te hanga maheni, te feiloaki, fe. E hanga ngai whakafeiloaki. Peko te alu ki ha feitu ukwai hamari, pe ha putu, ko tau ulnganga whakatonga foki. Ka oku to tonu peke mahino ka tau tolu, ko e tau mo ui o taha pe. E laka ame ke uta e whetau wheiloaki mo koe, ka tato e wheiloaki he tau kahao, ha mea e whai. Ha ta wheiloaki heni he twoi mo minute koe ni, pea ke alu ko sai kau alu au puke he COVID o mate. Pete ke te hau ko tangi mai, haku aho te umate ai, ka hiri ko yana ospehat ke ta ea hak pe. Mo ta ta anima pe. Ka tai mahino fok I kai hau ko ia sai pe ia. Ka koutu ko whainga mea pe to tonu ke si mahino pe ki ho tau kāinga, o kui kai ko ha mea ku kovi. O kai ko ha mea ku kovi. O kui kai ke to ai o whaia. It doesn't make you love them any less. Ko e te o whaia o to lahi ange, ko te tauhi hotova, ko e te toka I atu ia, moho no whamiri, moho nau kāinga, ke o te nau si ipuke. Pea koe whakahaya te whakaapa atu ki a nau tolu. Pea koutu koe kapa e mahino ko tau kāinga tonga, o whamai ia ke tau wheiwheinga mai ke tau he koe ni te tau osi auha tau tolu. O khange ni hafu whaka auha e kau pe au koe ni. Koe whehu I pe ema. Whewhe ni ka pau koe ni, pa koe whehu I koe ni ko ilo kulahi apit pe mo ni hia, hange kola nei, tari pe ke toki tuu ai manawa, hufanga he whakatapu, I he muaihu patogre ki whare mahaki. Mahalo pe ko si manawasi, ko kai kaha insiua. Pe mahalo wai pe ni kai mahalo haki fofonu pe, mahalo ko haki, saipe te saipe. Ka pau ka mata ke nau mau, whamatala pe mua ki he ngahi whakailonga, pa ke toi tuku at pe ha whare I ka nau tolu, koe whahinga whaunga ke mahine ka nau tolu, ka ku nau mau e whahinga mea koe ofa mai, alu ki whare mahaki.
So, symptoms, taimini, we test Utah has several tests, even our clinic. And our clinic even offers rapid COVID test. So it's just the lab test. And we offer both. So when rapid test, you get your results in 15 minutes. Okay, you take that with a grain of salt because it is only about 86% effective. So you have about 14%, you could be positive, but the test missed it. Okay, so lab result, that takes about 2 to 3 days to get your results, but that is 97% effective. It's like, oh, yes, it takes longer, but it's more effective. Either way, symptoms get watched out for. If you have one of those symptoms, you go and get tested, especially if you were exposed to someone who was positive, you go immediately, even if you're asymptomatic. If you have no symptoms at all, because government in these studies that up to 40% of the COVID positive cases, up to 40% are asymptomatic. So that's why I was like, you could be a super spreader and not even know it. And with the risks that we live in these multi-generational homes, just get tested. I was like, and a lot of times, even the tae in siua, oku pick up I government I pila. Ta ke clinics, like I know it's once a month, we have a bus that the Utah finances. And they come once a month and they're in the parking lot and they're there for 4 hours. And those tests are free. That are wary of not having insurance. But this is your opportunity. This is your opportunity that if you knew that you were exposed or and get tested. And then the symptoms, if you just have one of them, you go get tested. So fevers. I was like, COVID, if you have high fevers, that lasts more than a day. Sore throat. Tale, especially if it's a dry cough. Runny or congested nose. Another one is loss of taste or smell. If that's another symptom. Another one, difficulty breathing, shortness of breath. Or so deep breaths causes chest pains, even GI issues. If you're nauseous, if you are vomiting, if you have diarrhea, COVID can lodge itself, especially in the lungs, in the intestines, my brain. So just know that, like, if you have any of those symptoms, you go get tested.
Wow. Toketā Mo'unga o kuia ni ihi tohi ata, Facebook, o kunau tuku mai nau tohi, aia na anau ma'u, ai COVID tahiwa, pana nau hanga vahe mai, whamalo atu ki a ariria, kai pehe foki ki a teisi. Bloomfield, kolo, ha mo wawahe mai aho mo ngahi mea koe na nau. Ai koe ngahi mea tatau koe ke whakamatala ki ai. Ka koe tokotaha nei pehe e teisi. It has been a month, but ever since that she recovered, she hasn't been the same. So, ai ko mahino rewa he kaipe ke toi foki o tatau mahalo ke whainga tuunga. O kai nahano whainga UHINGA Ema.
So remember how we talked that these viruses, they like to lodge into those three main systems. Your ma'ama'a, your the ngaue, I mean brain. So most cases, 1/3 of people who get infected, it takes them 3 months to get over their symptoms. Yeah. So most viruses, they go away in 14 days. You have symptoms, it gets bad, it starts to get better in 7 to 10 days. Then your, the Vailasi has run its course, you're better. Not COVID. COVID, guideline CDC, you're not contagious after 10 days of becoming symptomatic, but your symptoms I was like, 1/3 of the people who get infected will have symptoms up to 3 months. And then some people don't recover at all. Athletes, they still have difficulty breathing, and that may take several months after, beyond that. So my advice is, if she had COVID a month ago, just be patient. I was like, just continue symptom support, see if she's one of the, the 1/3 that are having symptoms all the way up to 3 months. But then now that's the new normal. She may now, it's a lower percent. So depending on her age, chances are she might recover completely, but just be patient.
Koia. Kauia e whare I whakaofo o whaopito. Toketā Mo'unga, because of what you're doing, we salute you. We have so much love and respect for what you do, especially that you're there, and to those that you work with. I'm not quite sure if this is aligned with what we were asked to question you, but can you share from your point of view, especially what you do, what it's like in every day? Because I'm pretty sure it's not easy, because you have a family to come home to. And I don't know if a lot of us, we realize that you guys are not robots, you guys are not invisible, you guys are just like us, human beings. You have families to go back to. And as much as we're not careful out here, there's so many of us is going to end up at the hospital and clinics, and who's going to take after us or look after us is going to be you and everybody else that does that. So what I'm asking, can you please share from you, like a day in, day out, like this is actually what you do every day? And I'm pretty sure that you're going through emotional and you're thinking about that all the time, because it's not an easy thing to do.
Yeah, it's definitely not. I mean, it's harder when I see my hard hit patients. And, when all I can do is go fale'i. I can just fale'i and just, keep preaching until I turn blue, but like I said earlier, I work 14-hour days. I'm exhausted when I come back home. And it's very discouraging. And, our trends are not improving. It's getting worse. And, go dangerous thing, that is when it is extremely dangerous. And if we don't mitigate, this climb, right now it's not curving, it is climbing. And if we don't control that, you're going to be stuck in situations that you're hearing on the news, and they turn you away. And I'm already seeing that. I work urgent care at weekends, and, I was like, we're bombarded. I'm inundated with patients, who are just coming to get tested, and they have all these, I can't cure them, but I can help alleviate symptoms, help them breathe. But some patients, I cannot take care of you outpatient. I have to send you to the hospital. You need to be put on oxygen, IV antibiotics, IV steroids. And that's not something that can be done in the, and it's frustrating, and then I still see people not social distancing and taking it lightly. And fortunately, okutaunofo, heano masima, and our, last time I checked these stats every morning before I go to work, just to see where we're at. And we're at like 76% capacity at our hospitals. So 76 is not a good number, which means 1/3 of those patients who are admitted in hospital are ICU patients. And if you, Nataumaue text that came out on Friday, telling you, try to stay home on Halloween. If we stay home now, miss Halloween, then at least let's see if we do better for Thanksgiving, even Christmas. These are bigger holidays that are coming up. If we sacrifice the little ones, maybe we can make it to the bigger ones. And it's just very discouraging, when I'm doing everything I can, and the numbers are not showing anything. And that's how I caught COVID. I was like, I had COVID in August. and and I brought it home, and my daughter got it. And doctors are not immune to this kind of disease. We get it too, and that took me out. I was out for 14 days. I was like trying to get over this virus, and that could have been 14 days that I could have helped patients. But just to be safe, I had to isolate myself, get myself better before I came back, and I'm right back at it again. And it's just I've been doing this since March, and there's no end in sight. And I was like, I just wish people were a little bit more positive. And you're fatigued. We're all fatigued. The important thing is that we don't overwhelm our hospitals.
That's true. Whamalo lahi atu AUPITO. Toketā Mo'unga ko wakaihi fo ki he tohi ata, ki he Facebook o ku iai toko taha ngune tala mai, ko ene Toketā ko and you're amazing. And I'm pretty sure you already know her. This is Kalo, Fia. Ko e ofisine o foti pia mo hiva. Kako sigi hei voni ko osi ilo I AUPITO peho tau kainga tau tolo
Dr Ema
Mo'unga pe ngaue ku whai. Just the conversation that we're having right now, I can honestly feel your passion for what you do, but not only that, but the heart that you have for the people, and not only for our Tongan people, but for everyone that you serve in our community as a doctor. And I didn't realize that you yourself actually had COVID, and for you to share that brings at least to make our people understand, like I said, you're not invisible, and not just that you're not like, okay, just because I'm a doctor, I'm not gonna get it. Ko pau peke si mau ai aku tau tatau ko toa pe kono uhinga ku mau ki tau faka'eke'eke ko toa iai. Ka ginau tolo ko whatonga ko ai toko taha be me New Zealand. Na ne tohi hifo I he tohi ata be atatau pe na ne whakamatala ko ki nau tolu I New Zealand. Na nau tala ngofua nau tolu ia ki he nau lockdown ni pe nau nofo mau pe ko e taini mi o ku nau fie maari ange. O hange ki whakakaukau aku I voni pe mo Toketā Mo'unga ko tau tolu ko ini hano masi ma o tau kau tau tori hango ngata.
Tau fuongo ngata alahi AUPITO.
Ko whakailonga ko o ngata e u mahalo pe whakamore I ange au. Ka koe ongo ngata o ku tatau pea ki a te au pe kun mahalo kuna first kasini pe mo tae ofa. He kono ngā ka pau te u ofa au ki a au, pau ofa ki a Siosefa pe mo I voni, ko mea na nofo fuoloa ia to oko he letio ke sairere o te uha na whawhai kuna si ipuke. He ku iai e familia. Iai familia voni, pe au ki ai pe mohok familia o ko loto ke malu I ki nau. Ivoni?
Ka malo apio to Dr Ema Mo'unga te tau ki break in ki minutes I sika whai e mau station ID o skoea pa tau toki foki mai re ka maulolo tonga mea main ke Tala Koula I hiva noa po in hiva FM ko telefoni ko taha wau noa toni mahiva hiva taha o whai ha FETALANOA'AKI pa mo Dr Ema Mo'unga o fekau'aki pia mo e COVID tahiva pe fekau'aki pa mo ne ngaue fo ai ak hoko ko Toketā ke ne tokon ka tektato e ngahi fokoutua tauhi ka tatau te fito ke suka no ngahi fokoutua ko tau mau he kakaitonga the White Level Station ID time si pe patau to foki leva ke Dr Ema Mo'unga ke hoko ata tau potala
Support for KRCL comes from the National Tongan American Society, promoting health and civic engagement in the Pacific Islander community, and also offering a reminder for all to fill out the 2020 census and register to vote. More information at ntasutah.org. Support for KRCL comes from the Utah Department of Health, which provides official information on the coronavirus. The virus disproportionately impacts communities of color. It's important to practice healthy behaviors during the pandemic. For more information, visit coronavirus.utah.gov.
Thanks for all your support during KRCL's Fall Radiothon. If you haven't donated yet, don't worry. We haven't quite made our goal, so your donation is still greatly needed and appreciated. Please head to krcl.org and click the Donate tab and give what you can. Thanks. Support for KRCL comes from the Ute Land Trust, whose mission is to help heal people, community, and the world around us. More information at utelandtrust.org.
Registered but have yet to receive your mail-in ballot? Call your county clerk. Find contact information for all 29 Utah counties on the Go Vote page of krcl.org.
Malo apito pa to framanata fok to pe a heua pe fa o si leva e tau voti ka paure o te kai ke voti me atu ke fitu fai ai voti I he a monite me atu site ai apalani a ave ha me akai ave ha ki se ke tangu tuai kai ke hepe ku ke alu o voti kita foki leva ke tau polo kalama pa mo te Dr Ema Mo'unga pe mo merito folau.
Molo lo tonga mea mai, pea ke Veitatala, pea mo Toketā e manita tali Mo'unga, I he fia fini. Uko wakahifo pia ia ni ihi, unau si I whakarea mai, fia mau e ema, ai ngai faka'eke'eke, o fekau'aki pea mo ho ofika, pea mo feitu, pea koe ku osma, ku ostuku I hake pe e siosefa, I he mau Facebooka, tohi ata, pakahifo peki ai teisi, ka pau ke osi mau, pake lau peke ke tala mai, paka pae te fia mau, e toi tuku I hake pe e siosefa ke mou wakai mai ki ai. Ka ku mau whakamalo, ka ki mou tolu kotoa pe, ku mou tonga kau mai ki he prokalama ko ia e Tala Koula I he fia fini. O ku hange pe nai, o ku ki ingari mea e Ivoni pe mo Toketā Mo'unga, ka koe tau talanoa koe ki he COVID-19, o ku hange pe ha tau talanoa ki ha aho koe te tau peki ai. He kua osi hanga he e COVID-19 o to'o ai mo ui o I toko lahi ho tau ka inga Polinisia kai pehe foki ke mo ui toko lahi ho tau ka inga Tonga I he tere ani. Pe kono uhinga ai ho kai ke uhinga ke whika o tolu pe koe wha, pe koe nima. Kai manatu o kutoe iai mo ho tau whangatoko ua, mo e whangatua nga ani, whangatua whawhine I ngahi matakari ke hepe o tau tolu Polinisia. O kuna ue sia tatau pe ai palparema tatau ko ne o tau si whehangahanga I mo ia. Ko ia Ema, ko e ku whehu I pea aku ko ni. He ko osi whai ho talatala I whare, ko osi whai ho tokoni, ko ke osi whakahoko mai ki ho tau kāinga, na ake na e hoko tonu pe mea ko ni ki a te koe pe mosi o family. Ko whiwau hono whakakau I koe toe ha whahinga mea. E ongo ki ho tau kāinga. A hono MAHU'INGA ke tau faka'eke'eke. Kono uhinga koe whakautua koe ni. Koe hana hatu e whahinga whaunga. Mahalo pe na iai ha whaunga ia oku ke toi ilo. E koe hange koho lau, koho mea pe kwhai, koho o talatala I whare pe, whare I pe. Kai pete ke fo I ko herea. Ko tui ko tunga tatau ia ko mau e au heni pe mo siosefa pe mo Ivoni. Kai pege mau fo I mau tauria herea. Ka kua honge, whaunga, masiva ilo. Ke whakahoko ki o tau kāinga, ke mahino ki a kinau tolu o ku MAHU'INGA AUPITO, ke tau whakaehi, kono uhinga ko tau ngai family, wenau mo ui.
Yeah, and it's, I wish I had good news. I was like, unfortunately, they call COVID-19 a novel virus. So the reason why it's called a novel virus, it's because, we're still learning about this virus. Like I said earlier, ha cure. There is no cure for COVID. And remdesivir that you guys are seeing on the news, helps to mitigate symptoms. Monoclonal plasma, that is in trials. That's a lot of us don't even have access to that kind of medicine. Steroids, and that's as much as we can do is steroids decrease this inflammation to help you breathe better. That's temporary. Everything you take, there's a side effect. You take steroids decreases your immunization or your ability to fight this disease. But we have to weigh the difference. Vaccines are about 40 to 60% effective. So now even more than ever is the time to get your flu vaccine. Because kapau te ke ma'u the flu, this is flu season. Like matai flu season is September, all the way to Maasi next year. So if you get flu and you get COVID, that's a hospital visit. I was like, eleleaki igoe. So kapau okuyaye vaccine ke flu go fale ia tuia ka koe, get it now. And if you get the flu symptoms after you got your flu vaccine, just know that it did not come from your vaccine. Flu incubates for about 3 to 5 days. So either you were exposed before or you were exposed after. And I was like, because it takes your body about 2 weeks to make the antibodies from that vaccine. I was like, so it did not come from the shot itself. And kapau gai, if you have questions about that, I was like, research it. I was like, this is why it's very important. Do your research. But now is the best time to get your flu vaccine hitaimini during a pandemic.
Oko kaua ui he kofesio koe ema ki heni ihi koe rifia he alu koe o huhu ai koe flu shot. He na ako kau he tuo taha na au alpea pehai pesi tari hoku i maoni oni. Ka ke iloi mahalo ko ho o whare i koe ni he fiafini. Mahalo oku koe vave taha ia e ivoni Kono inga ke tatau pe whakamatala mo mea ko whaihange ko tuaki koe ni koe ke kore ke kakai. Ke nau ofa mai o tokanga koe ke ngaue ake awhi fofonga mo whano nau nima peka kunau lava nofo pe i api ko whakaofo ofa AUPITO pe mo ia tau he wā mamao fute ono koe kaweni he fiafi whakakoloa lahi ki he Tala Koula ke mau pe mo koe o ku maulawe i pe mo ua ho taimi koe ngaue koe o ke whakahoko pea o ku mau tala monu atu ki te koe pea moho whamiri kai te fito ki a koe koe ngaue kafa o ke whakahoko ko si ono toko nii a ho tau kāinga kai ke ngata pe ho tau kāinga tonga ka ki nau tolu ko toa pe me ngahi matakari ke pea mau whakatawange pe to iai hawhainga maari e pe he kaha te ke toi lava pe o toko ni mai o hau pe popo ki ho tau kāinga toi tuku pe hawhare i ke ki nau tolu he koutu i o kui he kai ke nau fo i ki nau tolu he whanongo he ko mahalo ko au pe ia mo i voni ku fo i kāinga he fo i whanongo mai ki a ki maua kai ke nau fo i nau tolu he whanongo ki a koe o ku toi si ai ha me a kehe te ke fie tāna ki whaka osi mai he fiafini ki he tau polokalapa.
No, I honestly, I would love that. I was like, please reach out to me. Go na go si oatu personal email ba mo ku cell phone ga Ivoni. Reach out to me if there is any questions that you guys have, about COVID, the pandemic, or any other conditions. I'm available. That's why I did my undergrad with NTAS, and I value community outreach. So I want to do my part in helping our people increase their knowledge and get better. So thank you so much for this opportunity.
Emma, it's an honor to know and work with you. You help us a lot. And I want all the church leaders and the community leaders out there listening to us today. If you need to talk to Emma, you really need to. You contact us. We'll give you her contact number. And she is more than welcome to come and talk to you. Thank you very much, Emma. Malo AUPITO e maukoloa I he fiafini. Ofa, Dr. Ema Mo'unga. Until next time.
All right.
Thank you. Malo AUPITO e.
Hey. Bye.